You hear a lot of sniffling and sneezing around town. Well, that's probably because mountain cedar season officially started last Sunday with very high levels. Pollen from the shrubs can make life miserable for allergy sufferers. The last few mountain cedar seasons have been mild, but we're told not this year. Dr. Paul Ratner is here. He specializes in treating allergies, and he's the medical director of Silvana Research. It's going to be a bad year. You've got the culprit right there.
I brought one.
This is what it looks like, right?
This is what it looks like, and if you look at it, you can see that the pollen on it is still very early and very immature, and so we're nowhere near the peak of the season. In fact, you saw the count today. It was the highest count we've seen so far. The reason I think we're going to have a little bit worse here is we have had a drought the last couple of years, and that did affect the mountain cedar. So I suspect with all the rain we've had this fall that we are going to have a pretty robust mountain cedar season.
Now, a lot of people get confused because we're hearing about the flu, people have colds, they're not sure if they have allergies. So are there some telltale signs that we can use to know what's bothering us?
Yeah, sometimes it is hard to tell the difference between the flu or just a regular cold or you know, any other type of respiratory ailment. But I think if you get symptomatic this time of the year every year and you're having just clear drainage and nasal discharge and fits of sneezing and drainage down the back of your throat, you've got to think about mountain cedar, particularly if you just moved to the area within the last couple of years.
So the season just started. What should people be doing? They're not supposed to wait until the symptoms start.
The season officially started last Sunday, which is about average for mountain cedar season. So the best thing to do is to start your medicine as early as possible, even preventatively before the season starts. So the best thing to do is get on the medications now and stay on the medications through mountain cedar season.
And when you talk about medications, are we talking about over-the-counter or prescription?
The best medications are the prescription medications. We're talking about the nasal antihistamines, the nasal steroids, the antihistamine decongestant combinations. But of course there are over-the-counter medications available as well. Anything is better than nothing. But get on your medicine now if you know you're allergic to cedar. Limit your exposure outdoors on the days when you hear that the counts are high, or we're going to get these northers coming in with these high north winds. And just be sensible about spending any additional time outside if you don't have to.
And it's going to be with us for a while.
Yeah, the typical season is 49 days long, which is 7 weeks. They've been as long as 10 weeks, as little as 6 weeks. So we really are looking at this going through the month of January and probably into the first couple of days of February.
Now, some people say, I've never had allergies, and now all of a sudden it's the first year I've had them. Is it something that you develop? Is it something that you can avoid?
If you're a native of South Texas, it takes you about 18, 20 years to develop it. So if you're 20 years old, 21 years old, and you're not having cedar symptoms, you're probably not going to. For people that move here from somewhere else, usually it takes 3 to 5 years if they've been exposed to other junipers, which are there in other parts of the country. So it isn't the first year or two you're here that you get it, but it's about the second or third year you begin to notice symptoms.
That's not a very nice welcome mat to throw out.
No, it's not very nice, no. Yeah. But it is unique to our area and to South Central Texas.
All right, Dr. Ratner, thank you so much.
Thank you.
It's not a pleasant subject, but we do appreciate your information.
Good to see you.
Thank you. You too.